All right, so Britta's back. We're going to confirm her test today. Today, we're going to do the low-dose dexamethasone suppression test. And even though that's a longer test, it takes 8 hours, we're doing it because we have a very high suspicion that she has Cushing's, and we just need to confirm it. We drew some blood just a few minutes ago, and that's going to serve as our baseline. And then we're going to give her some dexamethasone. Dexamethasone will mimic cortisol in her body, but it won't interfere with cortisol. So we give it, it should cause her normal feedback loops in her body to stop producing cortisol since we gave it to her. And my suspicion is that because she has Cushing's, that feedback loop won't work and we'll still see her cortisol levels get really high throughout the day. So we're going to check her levels in 4 hours, and then we're going to check them again 4 hours after that. So 4 hours and 8 hours total. And then once we get the results back, hopefully it's going to confirm that's what it is, and we'll get her started on medication. And it'll take a while for her symptoms to go away. Usually the first month or two, we start to see the excessive drinking and peeing go away. Over a few months after that, you start to see the coat changing. And then some of the changes to her belly and to how strong her muscles are, that may take 6 to 9 months to go away. So it's going to be a slow process, which is also why we don't want to delay in getting our diagnosis. Britta's lab results just came back in, so let's take a look and see if she has Cushing's or not. So all 3 of Britta's cortisol levels are high. So we can see here that her baseline cortisol level reads within the normal limits, and that's fine. Dogs who have Cushing's disease, their cortisol levels naturally fluctuate throughout the day. And so it doesn't necessarily mean anything that the first cortisol level is high or low or in the middle. What we're looking at though is how did the body respond once we gave the dexamethasone? Again, the dexamethasone is going to mimic cortisol and it should tell the body to stop producing cortisol. So what we would expect in a normal dog is that the cortisol levels would go down. So what we see here is while the cortisol level went down a little bit, you can see at 2.3, it is a full point above the normal reference range. And then again, at the 8-hour mark, it should have suppressed even more. And it actually went up a little bit, and again, is a full point above the end of the reference range. Britta definitely has Cushing's disease. So we have our answer, and we're going to start Britta on a medication called trilostane, and we expect over the next 3 to 6 months that she's going to have pretty dramatic improvements and will hopefully look like a brand new dog.